Hello, everyone, and welcome to our first episode of Research Stories, SSRG Research Stories. Today, I have with me a researcher by the name Ugu Emmanuel, and today we'll be talking about their study on barriers to the use of mental health services amongst men in Nigeria and the potential of digital mental health support. And the good thing is that we are discussing this study in the month of men's mental health when everybody's talking about the importance of men's mental health. So I'm going to start by asking Emmanuel to further introduce himself, and then I would ask the first question.
Hello, viewers. Thank you so much for always watching videos that SSRG uploads. And SSRG, thank you for having me in a special way today. Of course, as the person I am with has said, my name is Emmanuel and I do social research. And I do personal research and I also do research with a group. So I think that is enough information for you.
Okay, thank you. So the first question is, why did you people choose to study this issue?
Thank you so much. So the motivation for that study was our awareness as researchers, was based on our other research and based on our engagement with other people's research. We discovered that mental health problems are on the increase in Nigeria. There is high rate of mental health challenges in Nigeria, but even at that, the uptake of mental health support, especially professional mental health support, is very low in Nigeria. So we started asking ourselves what could be done to bridge this barrier. Because, of course, found out people do not take professional mental health support because of issues around stigmatization, the cost of getting such support, and even the
So
convenience.
are these the major findings of this your study, or are you talking about the introduction to the study?
Yes, of course, I'm talking about the main reason we decided to do it,
Okay, okay,
to do research. It's not the findings yet.
okay, okay.
Okay, so because of this reality, we now decided to research to find out what digital mental health support can do in the face of this challenge.
So can you quickly tell me the major findings of your study?
Yeah, the findings of that study were that digital mental health support has a strong potential to bridge this gap. It has the potential to make people begin to seek professional mental health support for a couple of reasons. One is that the issue of physical contact is no longer a barrier because sometimes distance, having to travel to see a professional or go to a hospital discourages people. But with digital mental health support, we found that this barrier can be reduced, and also the issue of stigmatization, because if you don't go to a physical hospital or a physical clinical facility, nobody is going to see you and stigmatize you. So it really has a huge support. It can encourage people to get professional mental health support. This the finding. Also, we also found in that study that the issue of confidentiality is still a problem because people still, fear that even though digital mental health support can assist them, but what if information gets leaked? What happens to their data? The issue around the
Ah,
what happens to expertise? How professional do these people engage? How professionally do they engage with the digital mental health support? So it's also a concern we discovered.
so what you just mentioned is that it has the potential, it has the advantage based on reducing distance, the cost, and the stigma of people
Stigma.
seeing you walk up to a mental health clinic. Because in Nigeria and many African societies, if you go to see a therapist, they will brand you a madman, and there is a lot of stigma. But
Yes.
with digital mental health, you can do it in the comfort of your bedroom.
That's another thing I was going to say. Because of that comfort, doing it from the comfort of your home, it's a reason why it has the potential. Yeah.
So, what are the implications of this study?
Well, the implications of this study is that there is need for the government and also the people that the mental health experts themselves who engage with digital mental health support, that there is the need for more culturally sensitive practice. This is the implication. Because when we talk about cultural sensitivity in this context, we are now trying to, talk about how people's information can be protected and how to engage with digital mental health support in a way that takes care of individual differences. So these are the implications that the issue of data, the issue of confidentiality that we found, it has a serious implication for policy and practice in the area of professional mental health support. So there is need for policies that should guide the data. Strong policy around clients' data. It's one of the
So the
strongest
government
implications.
has an important role to play in making sure
Exactly.
that clients' data is protected.
Policy and practice implications.
Yes, I have one last question for you.
Yeah.
Do you think that, because I believe that there is a growing number of professionals in Nigeria and many parts, African countries, and even the world over, who may graduate from maybe psychology, social work, psychiatry, and struggle to find a job. Do you
Yeah.
think that it can also help address that employment gap?
The use of professional digital mental health support
Yes,
by
yes.
professionals. Of course, it can. The reason is that there is the possibility of even self-employment. Because if you graduate and you are good at what you do, yeah, you don't necessarily need to be attached to a facility. People can call you on phone, people can have a Zoom meeting with you from the comfort of your houses, from the comfort of your homes. You can provide support and then you get paid for it. So it also has the potential to bridge that gap, even though there is the question of if someone is going to become self-employed in the provision of digital mental health support, what is the issue of, about licensing? Does the person have everything it takes if they are not working with a particular clinic, for example? But of course, it has the potential to do that.
I think even if you are self-employed, you still need license. You're still guided by
Yes, of course.
ethics body and regulations. And that's the end of our research stories. Thank you so much for telling us about the issue of men's mental health and the role of digital technology in helping address that. Please remember to like and subscribe and comment, share your views about our discussion. Thank you.
Yeah, once again, thank you so much for having me on my team.
You're welcome.